Have you ever wondered, when there were no blood sugar measuring techniques and insulin concepts in Ayurveda, how our ancient physicians used to diagnose diabetes? Ayurvedic physicians knew that sugar gets built up in the body and it is excreted through urine. Flies get attracted to such person and ants get attracted towards the urine of that person. Hi, I am Dr. Jyoti Shirodkar, practicing Ayurvedic physician since last 28 years and researcher in the field of Ayurveda for diabetes. Here at Bluemark, we attempt to bring the reality of lifestyle disorders. In this video, we are going to unfold what Ayurveda says about diabetes. Diabetes means sugar. Diabetes control means blood sugar control. The idea of diabetes revolves around insulin and blood sugar control. Is diabetes more than this? To know more, watch this video till end. Diabetes is a disease known since ancient times. A person excretes large amount of turbid urine frequently, and that disease is known as prameha. The causes, symptoms and pathology of prameha match with the current ideas of diabetes. Ayurveda describes the process through which diabetes develops in the body and of course the course of treatment. The concept was not just limited to blood sugar. Body fat gets deranged and then the process of diabetes develops. A person deposits extra amount of fats and it affects functioning of the body fats, which actually interferes with other systems too. Along with body fats, skeletal muscles, blood, nervous tissue, reproductive systems and many other systems get affected. Before sugar gets built up, there are lot of symptoms or indication body gives you. A person who eats fatty food, lot of sugarcane products, lot of dairy products, certain kind of grains and especially newly harvested grains, and if he is leading sedentary lifestyle, he is not exercising at all, his doshas, kapha dosh especially, gets vitiated in the body. Extra body fats get deposited in his body and that vitiated kapha vitiates body fats and other tissues. Along with vitiated kapha dosha, when vata and pitta dosha are also affected and medha dhatu is also affected, all these things together stimulate the pathophysiology of prameha. When there is a dominance of kapha dosha, it is called as kaphaja prameha or kapha pradhana prameha. When there is a dominance of pitta dosha, it is called as pittaja prameha, and dominance of vata dosha gives rise to vataja prameha. So basically prameha is of three types: vataja, pittaja and kaphaja. Vata, pitta and kapha vitiate or affect tissues like blood tissue, skeletal muscles, nervous tissue and other tissues. These permutations combinations give rise to 20 types of prameha. Now what is the use of knowing these types? Because according to the type of prameha, treatment course also changes. Now when the pathology of prameha starts, do we get any indication? Yes. Before vitiation of other tissues, body fat derangement gives you certain indications. These are called as prameha purvarupa or pre-prameha symptoms. Based on these pre-prameha or pre-diabetes symptoms, we can diagnose future diabetes. If we can diagnose this pre-diabetic stage as per Ayurveda, immediately the treatment can be initiated and we can postpone or delay or prevent or reduce the intensity of future diabetes. Is pre-diabetic stage described in Ayurveda, that is prameha purvarupa avastha, can diagnose future diabetes? Yes. We had organized a study to study prameha purvarupa avastha in normal healthy individuals. The participants of our study were young couples and their 6-year-old children. This was a part of world famous Pune maternal nutrition study. In our subjects, we found Prameha Purvarupas in normal, healthy, young, non-diabetic people as well as 6-year-old children. Those participants who were showing Prameha Purvarupas had normal blood sugar levels, but compared to those participants who didn't have any Prameha Purvarupas, these participants were showing higher levels of blood sugar levels. And of course, their lipid levels, cholesterol and triglycerides were also comparatively high. This gives support to the concept of body fat derangement or body fats involved in the pathology of Prameha, that is diabetes. When we further studied the insulin levels and insulin resistance by HOMA-R, the persons having Prameha Purvarupa had higher levels of insulin resistance and lower beta cell dysfunction. We need to apply this knowledge for the masses to diagnose diabetes at an earlier stage. Prediabetes or metabolic syndrome is diagnosed based on blood sugar, triglycerides, waist circumference and other things. But much earlier, these Prameha Purvarupas are manifested in the body, which can be diagnosed and which can be treated. More than this, Ayurvedic approach for diabetes treatment is totally different. We have to explore these concepts for the masses and prevent this diabetic epidemic. To understand more about diabetes and especially Ayurvedic Prameha Purvarupavastha, stay tuned and please watch our next video. More power to you to embark on your health journey.